Our project is Breast Foot Forward by Group G with Elizabeth Gitto, Tyler Pillow, Aubrey Ranzinger, Libby Schwartz, and Rachel Smith. As we know, regular exercise is beneficial for cancer patients. It improves and maintains physical fitness levels, maintains muscle mass, improves balance and decreases fall risk, and decreases the risk of anxiety and depression. Whole body exercise can reduce fatigue, improve strength and endurance, improve mood, and improve quality of life. As you can see from the graphic, some general health determinants and disparities include age, sex, genetics, social support, education and employment, physical barriers, socioeconomic status, and race. Risk factors specific for breast cancer include gender, older age, family history, race, obesity, and exercise. In regard to socioeconomic status, people with lower socioeconomic status have higher overall cancer rates. White women tend to have higher rates of breast cancer, but African American women have a higher mortality rate. Breast Foot Forward is a program that we decided to create for women in the Chattanooga area. It's going to be a free monthly program hosted at the local YMCA for breast cancer patients and survivors. We want to help promote physical activity and a sense of community. Healthy snacks will be provided by Vibrant Meals, and then they will be able to take group exercise classes throughout the facility. It helps connect women in all stages of breast cancer, and also to encourage physical fitness, which we know is important after cancer. As physical therapists, we will be there to provide screenings and follow-ups with the participants. PTs are able to screen for red flags such as possible lymphedema. We're also able to be on the lookout for signs of depression or anxiety, which can also follow cancer. We can also provide education and help people become more comfortable in their bodies and getting back to exercising. We can also become a referral source for women who start to develop a need for physical therapy. We can provide a sense of comfort for them because we can help educate them on what they need to do to move forward. The biggest need for our program is that exercise is important for improving health and well-being after a breast cancer diagnosis. Most of the programs that we found grouped all cancer patients together, such as Livestrong at YMCA. They provide classes for all adult cancer survivors. Recovering Motion does provide specific to breast cancer patients. They focus on aerobic and strength conditioning, a pre-surgical evaluation, and post-surgical therapy. However, there are only 3 total clinics nationwide. This would make our clinic unique. We think it's important to focus specifically on one population so they are more similar and provide a greater sense of community. The need for this program can be demonstrated by discussing the potential barriers to programs like ours. There is a lack of conventional funding, such as grants, making it harder to create. Women who have been diagnosed with breast cancer may develop issues with self-image. This can make it more difficult for them to want to work out with others. There's also the challenge to make behavior changes, especially if they have been too sick to work out for a while. As PTs, we can help make up for the lack of physician support due to our understanding of cancer and exercise. A big barrier is finding a location to host the program as well as transportation, especially with the lack of funding. Overall, this type of a program requires a lot of time and energy, which means we need dedicated individuals to make it work. Now to talk about the actual intervention. Specifically, PT role and education. Some personal barriers to physical activity include values and beliefs about exercise, barriers such as financial, time, and cancer-specific, and a lack of or inaccurate information about safe exercise. Some of the benefits of physical activity for breast cancer patients and survivors include relief from stress and anxiety, especially fear of movement. It can lead to increased strength and self-esteem, improved sleep, and more energy. As far as breast cancer specifically, it addresses deconditioning, cancer fatigue, lymphedema, and quality of life. As physical therapists, we can provide tailored physical activity that accounts for safety, body mechanics, pain management, fatigue, lymphedema control, and psychosocial aspects. The intervention, the need, and the rationale. Social support improves physical, emotional, and educational outcomes for breast cancer survivors. The main concern for breast cancer survivors is rediscovering their identity. Being in a supportive environment with others encourages this process. The intervention, survivor support. Listening and mutual understanding of shared experience is an important aspect of group exercise, especially for breast cancer patients and survivors. Persistent post-mastectomy pain is associated with psychosocial sequelae, including catastrophizing and fear of movement. The group setting helps to normalize the challenges that this population faces and ideally provides a safe environment to restructure self-esteem and build confidence. The intervention, a comprehensive approach. As extensive research has shown, having a social support system is incredibly important when taking a comprehensive approach to treatment. Our program hopes to provide a welcome place and a sense of community for those currently dealing or who have dealt with breast cancer. The social support that participants receive from others in this program, as well as healthcare professionals, will help to facilitate self-compassion and positive body imagery. Furthermore, with access to healthcare professionals, participants can receive information on lifestyle modifications for prevention of reoccurrence and ways to help create a positive quality of life moving forward. Some preventative topics include cessation of smoking, certain diets, daily exercise, and self-screening. While our program wants to promote a comprehensive approach, one of our main focuses will be providing exercise classes for participants. Each of the potential classes offered are evidence-based and have shown to have beneficial health effects on those who have or are currently receiving treatment. During each event, we will offer 3 of the classes based on interest and attendance, rotating each month to provide engagement and exposure to different exercise approaches. Some of the physical activity benefits for prevention of breast cancer reoccurrence include cardiovascular fitness, increased strength, decreased cancer-related fatigue, bone health, lymphedema management, increased sleep hygiene, decreased pain and anxiety, and overall improvement in quality of life. Some of the classes we will offer include strength training, cardio, yoga, Pilates, Tai Chi, aquatics, and spin class. To determine the success of the program, we will collect data using outcome measures given at their first time at the program and then every 3 months. We will use the Fatigue Severity Scale, Fear Avoidance Belief Questionnaire, and the Patient Health Questionnaire too. One of the outcome measures we will use is the Fatigue Severity Scale. This is a 9-item scale that looks at the activities of daily living, life participation, and sleep. We chose this one because we want to know how the participants behave in their daily life, and also because we know how crucial proper sleep is to health. The scores fall between 9 and 63, and the higher the score, the greater the fatigue. One of the perks of this outcome measure is it takes less than 5 minutes to deliver. The next outcome measure we want to use is the Fear Avoidance Beliefs Questionnaire. It contains 16 questions, and it has a maximum score of a 96. The higher the score, the more fear avoidance behaviors. This one also only takes 5 to 10 minutes. We chose this one because we want to know if there are certain activities that participants are avoiding, and then we will be able to work with them to feel more comfortable at being active. In particular, the Fear Avoidance Beliefs Questionnaire examines ADLs, behavior, functional mobility, general health, life participation, mental health, motivation, occupational performance, pain, personality, quality of life, self-efficacy, and stress and coping. The final outcome measure we will use is the Patient Health Questionnaire 2. This is 2 questions to screen for depression. We know how life-altering cancer can be, and we want to be able to refer participants who may be struggling with their mental health. A score of 3 or greater indicates a possibility of a major depressive disorder and should be referred. In summary, Breast Foot Forward is a free, community-based physical activity program for breast cancer survivors. The monthly meetings provide classes to encourage fitness and socialization to help with the physical and mental aspects of breast cancer. As physical therapists, we are able to screen for red flags, take outcome measures, provide education, and provide follow-ups for participants who come regularly. This is also a referral opportunity for survivors who may not be in physical therapy currently and develop a need for it.